most everybody just came from lunch, right? Or a talk or something. So do me a favor. Take one foot, and I don't care which one, and cross it over the other. And then take your arms straight out like this. One hand over the other. Lace your fingers. Pull them up. 3 breaths where the exhale is twice as long as the inhale. Okay, when you finish your 3, unwind. So we get switched. We get under fluorescent lighting, we get stressed, we start talking about things that are difficult for us. We didn't get enough sleep last night. We get switched, and our system isn't giving the brain the right answers or the correct ones for us to function correctly. So that's one thing to do. And these you can do all the time, anywhere. They take like this if I didn't stand here and talk to you about them. Second one, the governing meridian ends right here. Your central meridian ends right here. If you want to get your brain to talk to your body, you rub these 2 points. Let's all do it right now. We're getting the brain and the body talking. Do you know when you walk in a room, or you get to the store, or you go to make a really good point, and it's gone? I mean, the point that was going to win the argument, and it's gone. That's because the corpus callosum, those bundle of nerves that make the left and right hemisphere talk to each other, it shuts off. Under fluorescent lighting, under stressful situations, lack of sleep, all those things. So K20, I got a mic on, so I'm trying not to touch it. K27 are the 2 indentions right underneath the collarbone. This is on the kidney meridian. K27. So with one hand, you want to hit those, and the other hand goes over the belly button, and you rub. And then you switch hands, and you rub. And that gets those 2 hemispheres talking to each other again. So, real quick, this 3 breaths, exhales twice as long as the inhale. It doesn't matter the order. Kidney meridian, governing and central meridian. Oh, and I got one more. Pelvic bone, tailbone. You rub. Front of the body talks to the back of the body. So when I'm in Dr. Crawford's office, which is now a lot, and he'll say, I'm going to refer so-and-so to you, and I want you to do all the weird stuff, but I don't want you to start with the weird stuff. Relax them first, get them on your side, then do the weird stuff. So I start with the weird stuff because we don't have time, right? Okay, so those things will really help. And our systems are so amazing, how they work, how they repair, how we find ways to bring them back, right? And so before we get into the blood cell stuff, I've got a little story that I think does a good job of explaining how important it is for all the systems to work together. Because I do a lot of work with people. I do a lot of the emotional work with people. And what I have finally convinced my team to know is that if we don't do the emotional parts, we're not ever going to heal completely, right? And I know it sounds silly, but that liver dysfunction has an emotional root to it. And we have to figure out what that is. That person that always has the lung infection, that's not just a low working left hemisphere, right? Because we start our immune system with our left hemisphere, we modulate it with our right hemisphere, right? So if somebody gets sick a lot, from a functional neurology standpoint, the first answer is, oh, left brain deficit. Well, yeah, but there's so much more to it than that, right? So lungs are sadness, lungs are grief. What's the first grief we remember? Where does it show up in your body? We do all kinds of weird stuff with this, right? Because that part is so important, and Dr. Crawford had to have back surgery last year. and went through this PRP process that we're doing in the office now for the first time. And they worked on the emotional component with him. That was part of what he had to do. And he had the audacity to call me after it was all over and say, Jeri, this emotional stuff, so important. And I said, I am so glad we're on a phone call. Because if we were in the room together, I would poke you in the eye with a hot fork. Are you kidding me? Come on. Yes, it's important. So that's not my story. Hold on, I still have one. So I want to do a short story kind of about the way our system works, at least part of that. So I have a friend who was tall and willowy and so graceful, like she spent years living in an ashram in India. I mean, she's just one of those people that she just, right? And I'm like, the Sherpa, and we're walking through where are we? We're in Newark, and we're walking through the airport. And you guys familiar with Cinnabon? You know what I'm talking about? Okay. So they have spent $1 billion on the psychology of what makes you hungry. And all their vents in their stores or kiosks or whatever point out because they're trying to draw you in, right? So we're walking through the airport. It's like, I don't know, 11 o'clock at night. And she's like, do you smell that? And I'm like, yeah. Spent my life avoiding this. Yes. Oh, my goodness. And I'm like, well, we have time. We had a connection, right? Well, you have time. If you want one, go get it. Because I'm thinking 6'2", she weighs 12 pounds. I mean, how's this going to hurt, right? And so she's like, oh, no. And I'm like, really? No, seriously, we have time. Jeri, the gluten, the sugar, do you know what that would do to my system? I said, wow, you have a very well-developed prefrontal cortex. And she said, thank you. What does that mean? So, the amygdala's job is to keep you alive. And the amygdala gets a lot of bad press, right? It's always the bad thing. It's always the thing that makes you worry. It's always the thing that keeps you up. So it has reason to be. It is your alarm system. And we don't want to ever get where we don't have an alarm system. So with the amygdala's job is to keep you alive. And one of the ways to keep it alive is to get you to eat something. So the amygdala goes, we smell that, we want that, you should go over there. And the prefrontal cortex says, if it's well developed, says, well, wait a minute. Don't you remember sitting in Dr. Jeri's office and she gave you the whole talk about how sugar is Satan and gluten is like his sidekick, and don't you remember all that? And so we're not going over there. And the amygdala is like, we got to get a different doctor. And so then the amygdala says, no, seriously, we need to get over there, because it'll try a couple of times, right, just to get you to give in. And if it's a well-developed prefrontal cortex, it will hold off. Well, the amygdala doesn't care what you eat, but nobody's standing there with a bunch of celery trying to get your attention, right? The Cinnabon is what's available. And so if you try 2 or 3 times and the amygdala is not winning that, there is an immediate drop in blood sugar. And the amygdala says, see, we're dying. Get over there and get a Cinnabon. And the next thing you know, you are standing there with sticky lips and a receipt in your hand, and you don't know how this happened, right? So that's kind of how our system works. What I want us to do is to be more in control of our own systems. I do care if you eat Cinnabon. That's really not true. Well, I'm not going to divorce you if you eat Cinnabon. It's not that, it's a choice. But I just want it to be a choice. I want the things that we do and the things that happen in our body, I want us to have more control over what those are. So I can spend a lot of time with a patient and say, oh, well, so you have nothing wrong, so that's why I'm going to use you as the example, okay? Okay. Oh, well, obviously, there's inflammation. And things aren't flowing like we want them to flow, right? And even if I muscle test you, give me your arm for a second. just pretend like you know what we're doing. Even if I muzzle test and I get, oh yeah, your body's telling me, la, 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 la. It's just me talking. Why should you believe me? How many things have you heard from a doctor that couldn't be more wrong, right? Why all of a sudden have you found the fountain of information? And so with blood cell analysis, we're looking at your blood. I'm not telling you what I think's going on. It's going to be on the screen. We're going to see what's happening. We're going to see if you have enough vitamin D. I take vitamin D every day. Well, let's see if your body is actually using it like it's supposed to. Let's look at your vitamin ring. Let's see if you are processing the $7,000 worth of vitamins you are taking every day, right? Because when I put you on a protocol, not everybody loves me anymore because sometimes it's a bunch of stuff, but we have to make some changes. And this way, you see what those changes are and why we're doing them. So that's why this is, to me, just the next thing to add to the practice. So we're going to be doing this in Austin, and then Dr. Danielle Barron and I are opening in Atlanta, and we'll be doing this there as well. So, but I wanted to give you an intro and kind of see what kind of things we're talking about. So let's do this. Okay, so the first part's kind of boring, but I have to go through all this. So what we're looking at is capillary blood. So it's not a vein draw because you don't want venous blood. You want capillary blood because that tells you what's going on in the cell. So it's a finger prick. Where do people get finger pricks? On the tips of their fingers. Dumbest place known to man. All the nerve endings are right there. That's why it hurts so much when somebody pricks your finger. We use Heart 9. You don't even feel it. People have looked at the nutritional aspects of this, oftentimes with a medical frame of reference. And there's just so much that is easy to read and easy to correlate and stacks up time and time and time again. Like a white blood cell is a white blood cell. I don't care whose blood you're looking at. Mold is mold, right? A parasite's a parasite. That's always the fun one because everybody thinks they don't have any. Like the lady who comes in to see me who's bipolar and has 6 cats. And she wants to tell me she doesn't have a parasite. Let me show you. Right? Not that cats are bad. You just have to keep doing parasite cleanses if you live with a bunch of them. And if they're sleeping all over your head and face, call me. I can help you. Because this is real close to your brain. And there was even an article a couple of weeks ago. Did you see it? There was an article, they did brain surgery on a woman and they pulled this giant worm out of her head. So don't tell me parasites don't get into your brain. There was one right there. And most of them are tiny, tiny, tiny. So she's got one mothership. Just saying. All right. So if we look at their findings, even though there are some differences in opinion about this and that and what's happening, there's a central truth. The human body, which is a natural system, cannot live with an unnatural diet and lifestyle. We were not made to breathe in Roundup, right? We were not made to eat Little Debbie's or McDonald's or Cinnabon, quite frankly. They'll never let me be a spokesperson, so. All right, so what's the point of doing this? Because you get to see the visual proof of what we're doing. And I love it because I can get lazy about what I'm doing. And this is, okay, so one, yeah, I can get lazy. I was going to try to skirt over that. I can get lazy about what I'm doing, so it's nice to go back and say, oh yeah, look, I still have a lovely condo that's holding all kinds of interesting animals in my body, which I'll show you some of my stuff when we get to it, because mine's pretty bad, so I'm a good example. It shows imbalances in the system. If you're taking all those supplements, I need for them to be working correctly in your body. And if you're taking them and it's not showing up right, then we want to fix whatever it is we need to. Why? Otherwise, we're just spending a bunch of money for nothing. And we've already done that for years. We can monitor progress, and I like this because every 4 months, the blood completely rejuvenates. Is that a fair word? Yeah. You get new blood cells every 4 months. There's probably a fancier way to say that. And it is motivating. It's super motivating when you see some of this stuff. So it's easy. Small amount of blood is taken. So we do 2 things. We do live blood, where you take that drop, you put it on the slide, you put it on the microscope, and you see what's going on in light field and in dark field. The other thing we do that I really love, because I'm a psychologist, is the dried blood analysis. So you take 7, 8 drops and put them on a slide. Just for math's sake, let's pretend I'm 70, which I am not. And those 7 blood drops would be 10 years apart. So everything from utero to where I am at 70 years old, right? Every 10 years. So when we did, I'll just go ahead and tell you, because I don't have a lot of secrets. So when we first did this in school, because whose blood are you looking at in school? You're looking at yours, right? You and your classmates. And when we got to the dried blood portion, you can see emotional trauma, you can see physical trauma. That's where we see how your vitamin ring looks. We look at the lymphatic system, we look at lung, we look at all kinds of different things in that dried blood. And so there's 7 dots on my slide. And in the first 2, there's this weird black mark. And the guy teaching the class, he doesn't know me. And the guy teaching the class is like, well, that was probably the rubbing alcohol. And I'm like, we didn't use rubbing alcohol, we used Chem White. Well, there's probably something on the slide where it looks exactly the same in 2 different blood drops. Well, and he starts blowing on it. It must be dust. No. I know what the black mark in those first 2 dots are. That's my dad. The abuse from the first 12 years of my life, I know exactly what it was. And I was like, because you think, how much do you want these people to know about you? And I'm like, finally it was like, because he kept like trying to come up with some reason. I'm like, dude, it's my father. And he's like, oh, okay, right? So good, we don't have to talk about it, but I mean, it's cool, right? It just comes up. There's so many things, and I love that for the adrenal stress, right? So my business partner, when we did hers, the first 2 slides, first 2 or 3, adrenal stress was unbelievable. I mean, from utero. Well, super stressful household that she grew up in. Super stressful. And it's cool to see it because it's there. And it's cool then for me to be able to say, because then they think I'm like a wizard. Like, what happened to you between the 3, 4, 5? Did you fall out of a tree? Did you hit your head on something? Did you get thrown off a horse? What happened? Because you can see it. You can see head injuries. You can see spinal cord injuries. You can see those things. So anyway, it's cool. So we're looking at different kinds of imbalances. This is not diagnostic. I am not diagnosing anything. I will point out to you issues that we might want to consider further, or I may send you to a heart doctor. I'm not diagnosing anything. Does that make sense? Okay, that's my disclaimer. Y'all can stay. I don't mind. Yeah, I don't care. I didn't think we were coming to a quiet conference. And yeah. I'll give you the mic. How about that? You explain this next part. So, why does this have value? To me, it just helps me develop a treatment for lifestyle and dietary interventions that we want. And I don't know everything by looking at you. I can't tell everything that's going on. And so when we have the blood and we can actually see it, I can be like, oh, okay. Because, I don't know anybody who doesn't have mold, right? Everybody has mold, especially if you live in the South. It's impossible to not have it. But the point is we get our system strong enough where we can handle it. We don't want to live in a black mold infested environment, but at the same time, you're going to get in a hotel room. You're going to rent an Airbnb. You're going to have to go to your mother-in-law's. I mean, there's going to be times when you're in it. And so we want the system strong enough to handle those individual experiences. And this is a great way to see what's going on and how to do that. Why live blood? Because it comes in contact with every cell in the body, and that's why we're using capillary blood, much closer to the cell. Knows what's going on. Carries nutrients and oxygen to the cells, carries away waste. And this really we're looking at 1 drop of blood, but I can tell you it is a map of what's going on in the system. So if we understand why the blood is sick, then we understand why other cells in the body are sick. And if we're able to improve the quality of the blood, we will be able to improve the quality of almost every cell in the body. So difference between conventional and live blood. Conventional is stained, it's venous, it's viewed hours or sometimes days later. It's concerned with diagnosis. They're trying to tell you what's wrong. Only see the report. And with live blood, we use capillary blood, which we talked about. Nothing is added. Oh, that's not, okay, well, true, nothing's added where it is in the venous blood because it goes into, gets spun. And it's viewed real time. It's viewed in the moment. Live blood is concerned with prevention, and you actually get to see what's going on. You don't have to believe me. We're going to look at it. So unhealthy versus healthy. So the unhealthy, see how that's all piled up on, all those red blood cells are all piled up on each other? So that's not how you want it to look long term. Healthy red blood cells, so the little round ones are the red blood cells, and then do you see the big, I'm going to show you some, see that one? That's a white blood cell. This is how you want it to look, right? In a perfect world, and nobody's blood looks like this, FYI. Or nobody I work with or know. So there's a good example, white blood cells and red blood cells and a white blood cell. So the red blood cells, we want them to be uniform in size and shape. And white blood cells are about twice as large, and they're about 1 white blood cell for give or take every 700 red blood cells. So you don't see a ton of white blood cells in a drop of blood unless there's infection or there's something going on, and white blood cells are coming to the rescue, right? They're the cavalry. So here are some examples. So that first one is called a protein linkage. See how they get kind of lemon droppy looking? Okay. And they kind of stick together. That can be, and then the rouleau where they're all stacked on top of each other like a stack of pennies or that kind of thing. And then if you get big groups of those, that's fun. That's called blood sludge. So, and there can be lots of different reasons for this. That's one of the reasons this is not diagnostic. You don't look at a picture and say, oh, dude, you have, because everybody's different and everybody's life is different. So we have to figure out what's going on in your life and then see how that applies to this. Because this can be too much animal protein. It can be low HCl production, right? It's not the right diet for your blood type. There is something to that, by the way. It's not the end all be all, but there is something to the right diet for your type of blood. Processed foods, high sugar, carb, prescription or street drugs, excessive alcohol intake, smoking, heavy metals, minerals may be off, it's an inflammation marker. So there are all kinds of things. And symptoms, fatigue, lethargy, heart stress, poor circulation, blood pressure's off, edema maybe, blood sugar fluctuations, hormonal imbalances. See, one thing can mean a bunch of different things. That's why this is not diagnostic. It's why then we get together and we figure out what's going on. So sometimes you have these giant red blood cells, And that can be an overall lack of good nutrition or assimilation, low in vitamin B12, folic acid, A&E. Could be from poor digestion. Again, lack of HCl. HCl is a huge issue, right? And you guys know this. I know everybody in here knows this, but I can't leave a room without ever saying it. If you have indigestion, if you have heartburn, if you have acid reflux, don't take Tums or Pepto or whatever else they give out. And I know this sounds counterintuitive, but you don't have enough hydrochloric acid in your stomach. So you take HCl, and that gets rid of the acid. I know it sounds weird, but that's how it works. Okay, it's kind of like the sugar devil thing. I have to say it everywhere I go. So symptoms of this: inability of the red blood cells to adequately, I don't have my lenses on, carry oxygen, shortness of breath, fatigue, lightheadedness, different types of anemia. I meant to switch out my contacts and put my Erlen contacts in. I'm also the one that does the colored glasses, the Erlen. I can't do fluorescent light, so good luck the next 5-10 slides because I'm losing it. You'll have a copy of this. You can read it at home. All right, so target cells. I have a lot of these. So target cells are membranes who have collapsed on itself, possibly low iron or disorganized cellular island, bile insufficiency, weakness in the liver or spleen, or you're just freaking exhausted. Like, I don't mean you need a nap. I mean you need like a month in paradise, right? That kind of exhausted, yeah. Symptoms could be low B12 or folic acid, B9, and so, but here's the thing, we're taking all this, I'm taking all the stuff, right? But we got to figure out why your body's not assimilating it, right? Gas is a big with this one, just so you know. So helmet cells, it looks like a little Pac-Man guy kind of, yeah? They're cute. Yeah, some of the pretty ones are like the worst things ever, FYI. Because when Danielle brought this to me, she was the one that brought it to me initially, and she's like, she would send me these pictures, and I go, oh, that's so pretty. And she goes, yeah, that's Lyme. Oh, sorry. Semicircle or crescent-shaped red blood cells, low bile salt, low unsaturated fatty acids, liver and gall ducts may be plugged, so gallstones, indigestion, gas. But here's the thing, so I have my gallbladder so full of stone, it shows up on x-ray. Like in all, like I live in Atlanta, Life Chiropractic School uses my x-rays in class because nobody had ever seen that before when I went into the clinic. And so it's not that I'm anti-surgery, it's that it's so full that you can't smush it. And so you can't do the laparoscopic surgery. Gallbladder surgery, it's like at the circus, like they cut you in half. I don't have time to recover from that. I am busy. So I have always been able to, almost all the time, keep it under control. Everybody who knows me knows I'm like the super picky eater. Like I can't have this and I can't have that. And I can't have your sauce because I don't know what's in it. And so they just think I'm high maintenance and I'm okay with that. And so I'm pretty, every once in a while I get like something sneaks in kind of thing, right? Or I just had to have the onion ring no matter what, knowing that was a bad idea. But what's really cool is since we've really started to work on this stuff, I'm down 45 pounds, thank you very much. And I haven't had a gallbladder attack. And I hate to tell you that I have had an onion ring. So there's something to be said by figuring out how to make your body work right. Oh wait, hold on, sorry. So here are some parasites. So, oh, they're backwards. Okay, this picture, those, where we're in church, those are two parasites having a party. Little afternoon delight. Can I say that much? Okay. The other slide, a very big party. starts with an O. Okay. Yeah. So that's so fun to see. So this is fun to see to me because, you know, I don't know, people have this thing about bugs don't live in me. Well, duh, yeah, they do. We want them to be the good bugs. These are not. But it's right there on the screen. You can't deny it, right? There isn't anything else you can call those, because they're just humping around like you wouldn't believe. So there isn't anything else to call them. So that's fun to show somebody. Some of those are mine. All right, so biofilm. These are all me, just FYI. These are me before. So this is the first time we did the course and we're learning the stuff. So, and I had just started, so in my defense, I had just started the weight loss stuff, and you start losing weight and all that stuff has to come out, right? So I'm thinking that's why it's so bad. So we're going with that. So biofilm, so that's like, oh, you know those big trash islands out in the ocean? Yeah, that's fun to see floating around, yeah? Oh, okay. And biofilm is like that trash island, but it's like an all-inclusive resort, right? For bugs and other nasty things. This is a thallus. This is the Ritz-Carlton for bugs and other things. And so see how at the very top, see how it's broken? Because it was all one long thing. See how it's broken? Well, that's just awesome, because now that it's broken, all that stuff's going to come out and start their own little first, where do you go? First, like a little Jamaican resort, you know, we'll start small and work our way up till we're back to the Ritz. Yeah. So that's what a thallus is. But when you can see them in the blood, when you can see them in somebody's system, it just makes it easier to know, okay, I really do want to figure this out. Because blood's going all over the body. It's going up here. We want it to be as clean as possible. Dried blood is the other thing we talked about, right? So that's where you have all the drops. So this first one that's kind of got the pointy end to it, that's heavy metals. And the next one is showing us, would you think that's heart or liver?
Liver.
Yeah. That's not what I'd read where I found it, but I think that's liver, right? I don't see a heart sign either. So liver issues, right? Those kinds of things. So with the dried blood, it's really high magnification, and we can see, again, more parasite activity. We can see heavy metal toxicity, viral spiking. In this particular one, these are liver flukes. So if there's a lot of liver stress, so I believe in everything in moderation. I'm not ever going to lie to you. And sometimes I have patients that don't really get moderation, right? And so a lot of liver stress. So if there's a lot of alcohol or there's a lot, and it doesn't have to be, it can be that. It can also be an enormous amount of toxicity, right? It can be different things. We just then have to sit down and figure out what's going on and figure a plan. How are we gonna get rid of some of this? So on a dried blood sample, when you see these long lines going through, if they go part of the way out, I worded this so well, it indicates possible food sensitivities. And if it goes about 3/4 of the way out of the blood drop, possibly airborne allergies, right? Because it's getting into the lung ring. And if it's getting into the lung ring, it's something that's in our respiratory system, something we're breathing in or we have been breathing in. So that could be anything from a seasonal allergy to Roundup, or if you work in a chemical plant or whatever, right? If the lines go all the way to the edge, that could possibly be a mineral imbalance. And I don't mean like you need CT minerals. I mean like your teeth are crumbling minerals, right? So it's really helpful and gives us just some really good information about what to do and how to do with this. So there were 1,000 things I could show you on here, and these are the ones I put together. One, these are ones that come up a lot, and two, it's all individual. It's sitting down, it's looking at it, it's figuring out where we are, what we want to do, that kind of thing. If you want to contact me, you can send me an email from the website, and that's probably the easiest way to get me. And you can call. If I don't answer, it's because I'm doing something like this. Leave me a message if my voicemail's not full, and I'll call you back. So it's a lot of information, and for some of you it may be kind of new information. I don't know, it's really interesting. Every time I start talking about this, because I'm so excited about it. And I'm pretty new to this, just in this last year we started doing this. And so it's fun, and it's interesting to me. Who's the girl that just went to prison for the company, and they were using live blood to determine long-term? Do you know what I'm talking about? I can't remember her name, but you know what I'm talking about? Yeah. So I get that a lot. Oh no, we don't want to do that. That's illegal. That girl went to prison. Well, because she had a Ponzi scheme going, and she wasn't talking to a patient about right here today, here's what we're going to do. She's telling medical companies and others that she can determine years down the road what's going to happen to them. That's not what we're doing. We're looking at where we are right now today. Okay? Do you guys have any questions? Yeah.
At the beginning, you mentioned those exercises that you're having. What was the one underneath the collar?
Oh, K27, kidney 27.
Can those? I'm assuming it's like nerves.
So.
Or can you explain?
Yeah. So in Chinese medicine,
okay,
we have meridians that run through the body, right? Energy lines. And the kidney meridian comes up the front and it ends right here. That's the last point on the kidney meridian, right? So that's K27. That's why we use that point. And what they have been able to determine, which I think is super cool, is that when you stimulate K27, that activates the corpus callosum, and it makes the two hemispheres talk to each other. And for any of you that use a laser or have a laser, and I don't even care whose laser you have, the frequency of the red light, not the infrared, but the frequency of the red light going in is the same frequency of a needle. So it is needleless acupuncture. So, and one of the reasons that I started acupuncture school, not because I need something else to do. I have 2 PhDs, and my husband had to call me Dr. Jeri for 6 months. That's probably why we're not married anymore. Live and learn. So, but man, would I like to see his blood. So, but the reason, honestly, the reason I got into the acupuncture was because I'm one of the moderators of the laser group we have on Facebook, right? And I don't answer all the questions because I'm not a chiro. So I don't know the answers to some of those questions y'all ask. So if it gets not answered, not my fault. I answer the ones that I feel that I'm qualified to answer, or that I ask Brandon what to put and he'll tell me. So somebody gets in the group and we'll say, I have a 7-year-old, she's nonverbal, where do I put the laser on her head? We're not putting the laser on her head. That's not where we start, right? From the neck, I'm pretty comfortable saying this, because I'm being taped. From the neck down, except for the gut, or, and listen carefully, or if you are super fragile, you can point and shoot the laser. And some of us can take an hour on the gut, ironclad stomach people. Some people can't. The gut's the only place you have to be really careful unless you are very fragile. Then don't listen to anything I say for the rest of the 15 minutes. Okay? This is a problem we run into on the calls. Ryan Cedarmark and I do neurosolution calls. I'm doing my best to get them back on a regular basis. That too is not my fault. So, I have set a timer on my phone, and every 15 minutes I have to stop the call and say, and Eddie knows this because he's heard me say it 1,000 times, if you are fragile, do not do the protocols that we're talking about tonight. If you have a plan from a doctor that you paid $1 billion for, use that. But I want you using the laser. I want it to be the first thing you think of when something goes wrong. It is a medicine cabinet and a flashlight, and nobody takes advantage of it like I want you to. So, the reason I started the acupuncture school was because of those kind of comments. Because when you have somebody who is, that person, and their answer to everything is no, their just immediate response is no, and you're going to talk them around, and you're going to get your own way, but it's going to take a little while to get there. Okay. That's an over-aroused basal ganglia. That's all that is. It's an over-aroused basal ganglia. That's why the functional neurology is so important to me, to psychology, and the two need to go together. It's not because you're mean-spirited. It's not because you're a pain in the butt. It's because your basal ganglia is over-aroused. What's the best place on the body to get to a basal ganglia? Gallbladder 34. It's on the outside of your knee. Gallbladder 34 is the best point on the body to reduce overactivity in the basal ganglia in your brain. Yes, you can go in through your nose for 15 seconds at a time. You can leave that sucker on for 30 minutes. Got 2 lasers, put 1 on each one. Want to do some vagus with a laser, then put the SIBO or put the TENS units on those. Stimulate them or use a Resemax, whatever. So those kinds of things are the reason that I went that way, because I want you to use it. If you're in a lot of pain, under the essential oil file, in the laser, don't go get the oil. I don't know why we have to have this conversation so much. It's not a bottle of oil I want you to get. I want you to find the essential oil file on the laser. Find the rose. Rose is amazing for pain. Because every time I'll put that in the group, somebody's like, I put the oil on and then I laser? No! Just use the file in the laser. Those kinds of things. So one of the things that I'm working on now is a database that has every point, every solfeggio, every acupuncture point on the body, different protocols that we use for pain or that we use for indigestion or inflammation or those kind of things, and I'm putting it all together in one big database. So you'll be able to go to the database and you'll be able to type in anxiety. And everything that we know that is research-based, that works, will come up. Because not everything's going to work for everybody, right? Everybody's brain and body are different, right? And so you can see the ones that we know have worked. Somebody yesterday I saw it, may have been in there longer, but asked for a Bell palsy protocol in our group. I put in my favorite Bell's palsy protocol. It works like a charm 85% of the time. Right? We have others. If that's always my go-to because it works so well, but if that doesn't work, we try something else. So those kinds of things are important to me. And the reason I think this goes together so well with psychology is because when somebody comes in and they've got all this blame and all this shame and all this guilt, and they've been told for as long as they can remember, oh, you're just negative. You're just super negative. Everything about you is so negative. Well, guess why? It's the strongest pathway in the brain. It's the deepest groove. It's the easiest one to get on. It's the easiest road to get on. It's the fastest highway. That's the only reason. It's not that you're a bad person. It's because that's the deepest pathway. So what we want to do is we want to make another pathway that's positive, and that becomes stronger than the negative pathway. And when I can take the shame and the guilt and the self-crimination and all those things out of therapy, wow, we get well a whole lot faster. And it's not maybe all that simple, but that's a big piece of it. And if we start there, then we can work on the emotional stuff. I don't want to spend 6 months talking about your mama. That is not my job. People come in, they think that's what we're going to do, and I stick a laser in their mouth. There are other places I could put it, yes, but kills two birds, one stone. So we're working on getting the system balanced, and we're working on finding ways to create that balance. And this is my new shiny toy that we're adding to that database of what we use. And I love this because it's not just me telling you, it's you telling me what's going on. And I love that. All right, any other questions? Anything you guys want to know, or something I said too fast or incorrectly?
What about, like, you were talking about, like, the heavy metals and, like, the parasites, all that stuff? Like, do you do, like, detoxing from heavy metals?
Absolutely, absolutely. And one of the cool things, so I'm a cherry picker. I am super loyal to the people in my life that are in that tight circle. I am not loyal to supplement companies for any reason, because I don't think anybody's got it all figured out. So I like a couple of things from here and a couple of things from there, and right, that kind of thing. One of the things I like about Cellcore, even though I think they're too expensive, but one of the things I like about them is they have figured out that you don't do a parasite cleanse in 3 days, 5 days, or 7 days. I mean, it's ridiculous. Your body doesn't work like that. So all you do, or did, because they've changed it, all you did was just get everybody all stirred up. And then it's over, and you're supposed to feel better, right? And what, tonight's the full moon? You know this, right? Do you know why people get weirder around a full moon? Parasite activity is much greater during a full moon than it is at any other time of the month. So when I was in, 1,000 years ago, when I was doing my undergrad for psychology, they made us, and I lived in Atlanta and was going to school at Oglethorpe, and they made us go to, so Grady is our indigent hospital in Atlanta, right? And so if you're in Atlanta and you get burned, you tell them to take you to Grady. It's the #1 burn center in the world. If you break your leg or have a heart attack, ask them to take you anywhere else. Okay, when you come to visit, I need you to know these things ahead of time. And this isn't in the pamphlet of Welcome to Atlanta. So, oh shoot, where was it going? Hold on, I'll find it. Oh my God. So we had to go, they made us do full 2 moon nights. You had to sit in the emergency room and the nurse had to sign your thing from like 11 p.m. to like 3 o'clock in the morning and just watch what comes in. I promise you, on a stack of Bibles, I am sitting there thinking, well, this is the dumbest assignment I've ever been given in my entire life, because I'm all of 19 years old and I know everything. And I am not kidding you. This man walks in and he has a hatchet sticking out of his head. I'm like, oh, that's why she sent us down here. Wouldn't you love to see his blood? Or if he did not wield it, the wielder's blood, that would be amazing, right? So yes, that's why, so when we look at blood this afternoon and tomorrow, do not be surprised if you see extra parasite activity. So the very short answer to your question is yes. And I will be more succinct this time. In that it's finding the right protocol for you. I am doing parasite cleanse right now, and I can't do the intense ones because I have to work, and I have to be able to talk to people, and I have to remember them when I've met them before, and that kind of thing, which is hard for me. And so with the way we do a cleanse, it's enough support to allow the detox to happen, but you don't have to spend a month in bed. I don't have a headache. I don't have a lot of brain fog. Am I releasing toxins? Yes, I can tell you that I am. And I can still function. And that's how I think we should do everything, right? So many of us, at least my generation, were brought up that, it's supposed to be hard and you're not supposed to have any fun and, all that kind of stuff. No, I want it to be easy. And so many of us in this room have not had easy. And it'd be nice for things to start getting easier, right? And so detox is first place we start with easy. We're going to make this work. We'll do it as slow as we have to do it, right? If money's a concern, then we're going to pick the big things and we're going to go there. If money's not a concern, we're still going to do it slowly because I want you to come back. If I give you something to do and it makes you sick, you're not going to come back and see me. And then you just don't like me because you spent all this money and it didn't work. Well, no, it didn't work because it wasn't what you needed, right? Yeah, does that make sense? Anything else?
Have you started the PRP yet?
We have.
What are the benefits?
So, okay, I'll be real quick. Here's truth. So when Dr. Crawford first told me about it, I was like, dude, that's a lot of money. And what are they getting? Like, what's happening? He's like, so he sends me, Brandon, sends me like 6 months of research on my phone. And so I'm like, okay. So I start going through it and I start reading it. Well, I have a family I work with in Europe, and money's really not an issue. And we had seen huge benefits for anoxic brain and for near drowning and muscle and bone rehabilitation, those kinds of things. Brandon's back surgery, they did PRP around that. And so and I had a kid I'm working with who is physically functions fine. He's at this point, his parents have done so much work for so many years, I would still call it active autism. And so they came to do it. And I'm like, let's just see, because most of the ones we've been doing it with are nonverbal. And you see physical changes, but we weren't able to see a lot of the cognitive things so much, right? Or not on this level, let me say it that way. Yes, we're seeing big cognitive changes in little people too, but not, it's different when you're 17 versus you're 2, right? Okay. So it's shocking to me what we got for this kid, what he got. I mean, he did all the work. He was laying there. So what happens with the PRP is they take the blood, and there are little cells in your blood, and I can't think of the name of them. They are like little stem cells, right? And the helix laser that has the helix wave, like the DNA, it activates those proteins, those things in the blood. God, don't let Brandon watch this. He'll kill me. Not a chiro. So it activates in the blood, and then they spin it, and then they put it, and then then it gets activated with the laser, and then it goes back into the body, and then we laser the parts of the body where we want those cells to go. So that laser acts like, and it's not our laser, it's a different laser that has that helix wave, right? And it activates, it acts like a magnet, and it pulls those activated cells to those places. And when you laser those areas, it makes the tissue really sticky, and it makes then those cells adhere there better. They stick better. With my 17-year-old, we have compassion for the first time. And as a psychologist, I would tell you, you can't teach compassion. I don't think it's possible. We have compassion. He is not the only person that he worries about anymore, which I didn't think we were ever going to get past that. And it's not even really narcissistic. It's more like 6. You know what I mean? So he is an active part of the family now. Talk about over-aroused basal ganglia. Whew. Well, in any way changed this kid's mind when something happened. And now he will transition within a Zoom call when we're talking, which is amazing to me. So it's so exciting for me to see the cognitive benefits that go with this as well. I am on the list because I'm going to do a double. I'm going to do my knee, and because I don't want to have surgery, and I'm going to do my brain because I would like this to continue to work for the foreseeable future. So yeah, I think that the PRP is an expensive procedure. I think the benefits of it are amazing. Of course, if somebody were interested in it, I would tell you to do it with Dr. Crawford and I, because we're really good at it. There are other people that do it, and I'm sure they're lovely as well. I just don't know them personally. So, anything else, you guys?
Do you take like out-of-state patients then? Like,
I do, but the problem with the live blood is you have to be in. You got to come.
You have to come to you.
Yeah. What's closer, Austin or Atlanta? Okay. You can send dried blood. That I can send you, but then the hardest part of this whole procedure is taking the blood. It has to go on the slide exactly correctly, or it doesn't work. So that's the bad part about even having somebody send in the dried blood is hard, you know. But oh man, it's just so fun. Yes, ma'am.
So then you don't have any reference as to out-of-state people?
Like for
You
other
wouldn't be
people?
able to refer something, yeah.
Oh,
Like other companies?
okay. There are. Does Country Health have a? Do they have a thing that tells you?
For sure. But if you called them, I'm sure they would refer you.
So okay. So country. What is it?
Health clinic.
Country Health Clinic
Pocatello,
in
Idaho.
Pocatello. I always say Pocahontas. Pocatello, Idaho. That's where we trained. There are other people that do it. I'll tell you what, if you've got all my information. If you find somebody and you want me to investigate them, I am more than happy to do that. How's that? Okay?
That's amazing.
And I would tell you, get a group together and we'll come do it, but go down to our room and see the microscope. It's not like a lens kit. I can't travel with it. The one that's here, Dr. Crawford's buying from me because I can't take it back and forth from Atlanta. It's not something I can travel with. And they're too expensive for even me to take that risk. So, but I'll help you find, so for anybody, if Atlanta or Austin is not convenient, let me know and we'll see if we can't find somebody reputable, but let's just make sure it's somebody that we really trust what they're doing. Because I don't want you to go spend a bunch more money on a lunatic. Yes, dear?
You said that it was expensive on, like, what?
Oh,
is
the
cost of it?
PRP?
Mhm.
Okay, that's different than what we're doing, right? You get that. The PRP process. Okay,
I
okay.
feel like they're both different.
Okay, good. So ours is super cheap compared to the PRP. So ours will sound like it's free. Okay. So the PRP process, I don't know what other places charge. In Austin, it's $11,500.
Okay. And what about the,
Except, I don't know if we can take, yeah, I guess we probably could. So for September, September's over. For October, it's $9,500. And we're doing it 3 times in October. For this is probably an hour appointment to go over the blood and then a second appointment to go through supplements and that kind of thing. That's typically for me like $250 an hour kind of thing. I want to keep things where it's doable. I also want, and this is ugly, but I'm going to tell you, I also want it to cost enough that people pay attention. Because Americans are the worst. About free doesn't have any value. Are you kidding me? I have friends all the time. Come over, we can fix that. Just come to the house. I got all the toys. No. But if I charge them $600 an hour, all of a sudden, it just doesn't make any sense. Anything else?
Would that blood test tell you what medications would work best for your child? Like, you know, like let's say if they're on a seizure med and because we read something about where they do a swab of the mouth.
Oh, yeah.
And it tells you,
If you've had a root canal, yeah.
So So it tells you, like, you know, if like, oh, this medicine works better for this body.
It's not going to do that, but where it's going to tell us is what they're currently taking. That is going to tell us in some ways where it's working and where it's not, because we're going to get to see the areas where it's imbalanced. Does that make sense?
That makes sense.
Okay. All right, my time is up. Thank you very much. We're down in room 100, so if you have questions or you want to come by and say hi, we are not doing live blood here, but I have except for people who work for NeuroSolution, we're doing some of theirs, but you can come by and see what it looks like. It would give you an idea of what an appointment would feel like, that kind of thing. But just for the poor church and insurance purposes and all that, I can't just open up shop. Because I want to get invited back again next year. Okay, but come visit us, please, all right? Thank you guys so much. I appreciate it.